This is what drives me insane about health providers here in the United States, especially ones covered by Medicare and Medi-Cal. I finally got my insurance in and things like that, and both my eye doctor and my regular doctor keep insisting that I need to see neurology, but their soonest appointment is like in January. I had to fight for a nephrology appointment, despite the fact that I've been consistently seeing a nephrologist for my condition since I was 19 years old. And the closest they could give me was February, even though I'm symptomatic right now. Not to mention all of the other things that are flaring up. You see, my hormones are making me grow myself a mustache right now. But all the tests are normal according to them. And it's very, very frustrating when they do this because essentially they're having you prove all of your conditions over and over and over again instead of believing what you are saying, which is fine. You do you, boo. I will continue to do me because essentially none of your treatments were effective long term. However, my lifestyle changes and my food changes were. Essentially, you as providers are demonstrating and proving that the healthcare system here in the United States is bullshit and is willing to let you die instead of doing better. And they make all these excuses about funding and our current administration and everything like that. But this has been going on since pre-COVID with all of the insurances. Because essentially I've had Medi-Cal for quite some time and I was on Kaiser for a really long time, and Kaiser was just as bunk as everything else because they stopped caring about patient care and started only caring about their capitalistic money-making agenda, which is completely fine. As I said, I am privileged enough to be able to go to another country if I get sick enough instead of waiting for you to kill me like you have done for hundreds of thousands of Americans here in the United States. But the fact that Americans here in the United States are not fighting for universal health care so that insurance companies do not continue to do all of this bullshit just for their billing practices really astonishes me. Because essentially, if you guys wanted better healthcare, that is what you would have to do. The American people would have to band together and demand universal healthcare. Because essentially, as long as we do not do that, and those of us who are privileged enough to go to another country and seek the help that we need when we need it, this country will continue to do whatever the fuck they want with your federal tax dollars. And you guys are permitting it and then complaining about it when they start to use that as a bargaining chip to be able to pass laws that affect the general public, everyone in the general public, from the youngest to the oldest. And essentially, it's on all the American people, because I can talk about it all I want, but from my point of view, I've been doing it, doing the complaint processes, doing all of the motions that each insurance requires and the advocates require and everything, and demonstrating point by point where all of the issues lie. And it's essentially affecting my nervous system to the point where I've been having ridiculous amounts of symptoms because of how much they have been intentionally damaging my care and leaving gaps in care. Like, oh, but you're starting over again. Yes, I'm starting over again, but that doesn't mean that the chronic illnesses that were already diagnosed need to be ignored. The more you ignore them, the more symptomatic I get. And I get it for you, your testing and all this bullshit is showing something. Yes, when you have comorbidities, I've said it once and I'll say it again, some will affect the symptoms of the other. Some will mask the symptoms of the other. Then you're going to have different types of symptoms for different types of problems. Essentially, until you guys stop treating each body part separately, you're going to continue to see this problem. That's why universal health care is important, because then all doctors receive the same education. Right now, they receive a very limited education depending on the schooling that they're getting, and their continuous education depends on the companies that they go and work for. And essentially, it damages our ability to get proper health care. So again, if you guys want to continue to allow your government to use your health as a bargaining chip, keep going at where you're going, because essentially we're all going to end up disabled one day. There's no person I have ever met that has not, even the people who claim, oh, we're so healthy, have developed cancer and other things like that and needed healthcare at one point or another. So the fact that you are not willing to fight, you would rather, what is it called? like go online and collect money from people to be able to pay for your surgeries and so on and so forth. The fact that you would rather do that than fight for universal health care as a people is really sad for all of you. For all of you, because I've been advocating for this shit for years. For years advocating for changes in the system. And some changes have happened while others have not. But essentially, it needs to happen on the upper levels at this point. Take profits out of healthcare so that people can actually be well. As long as profit continues to exist within healthcare, we will never have universal healthcare because these corporations are still profiting out of it. And they also benefit from not giving certain treatments in certain places, because even my acupuncture, I'm having trouble getting my acupuncture for my shoulder and my migraines approved without seeing neurology all the way in January. I'm having difficulty getting those things approved because they say my insurance only covers back pain. So essentially, you would rather medicate people and make them into drug addicts in this country than actually treat people with alternative treatments that are actually less expensive than your pharmaceuticals. It's all about profit. And a lot of those pharmaceuticals, they're components that are inside of the medicine. Yes, some of them are made, they're not all synthetic, but some of them, they're not all synthetic, but they're all containing preservatives and other chemicals that affect the body and the nervous system in a million different ways, that affect the organs in a million different ways. So you guys can continue where you're going and making up all this shit about, oh, the people are the problem and disabled people are the problem and the president is a problem and blah, 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 blah. Yes, those are all problems. But you know what the solution is? Fighting for universal health care. Either we all get well or nobody gets well. Because essentially right now, the people who get affected are rural communities and low-income communities. Those are the ones highly affected. And I was being told, well, that's why you had Kaiser. Kaiser's one of the best and blah, 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 blah. Despite having Medi-Cal with Kaiser, they wanted me to put my Medi plan with them, my Medicare plan, so that I couldn't go outside of Kaiser at all. So that I would have to rely on their biased opinions and the lack of care and the denial of care. And there was a huge amount of denial of care this past year. It's all in my complaint systems. And they all kept hiding it within the system. You guys can continue to do that, but you yourself are collapsing the system. So don't be surprised when you get ousted. Because essentially, the more people talk about their experiences, lose the fear, man. Like, yeah, they might fuck with you, but essentially, you're fucking more with them. That's why they keep fucking with us. Because the more we talk about it, the more the truth comes out about what they're actually doing. And everyone's like, well, some of these things are ineffective because talking about it online is spreading a lot of misinformation and blah, 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 blah. The groups are talking about it online because essentially we're finding links to things. And that's why I said, look at all the emails I sent all of my specialties within the last 15 years. I will sign the papers for you to fucking do it. Demonstrating how it was correlated and it was hormonal as well. It gets highly affected through my hormones and so on and so forth. You want to keep limiting the amount of testing that you do and the baselines, which are completely not made for the female body or for what would be a zebra or a unicorn body type. These are bodies that are difficult to diagnose because their bodies respond differently, not only to medication, but also to disease itself. Not all nervous systems are the same. Not all physical bodies move and react the same way. It's why medicine in other countries, I've had Chinese medicine, it doesn't go based on my body weight. It doesn't go based on a baseline of blood work and things like that. It goes based on a physical examination and those other things, plus the knowledge and wisdom and experience of that Chinese medicine practitioner. I've had Hindu, it would be Indian medicine, Ayurveda, I think it's called. All of these different types of medicine. In Mexico también, when I would get sobadoras and things like that. Every single one did their things differently and did not rely fully on medical testing such as blood work and scans, because a lot of your scans aren't going to show you when the problem is first starting. You're waiting for people to be so sick they cannot function because you don't give a fuck. But the symptoms are telling you when the problems are beginning. And y'all ignore those problems for years and years and years until they become very serious problems for some people, instead of giving the proper accommodations so that people can essentially change their lifestyle and get proper food to be able to sustain that. And until Big Pharma starts to admit that food is medicine, they're also going to keep polluting our food and reducing soil health. Because essentially, it's good for them for us to be sick. Because profit in healthcare does that. So you guys keep going with what you're going. I already said it. As soon as I realize that you're still trying to kill me, I'm going to leave the medical here in the US to you guys. You guys do whatever the fuck you want. I will continue to get my medical care in other countries because essentially you don't give a fuck about the human body. You don't give a fuck about your people, even though as a doctor, you should care. You should care because essentially right now, the witch trials are against you right now. And the proof is in that you guys don't want to do better. A lot of you do not want to do better. So moving the appointments out to keep people further and further in your system to try to prove or to try to disprove what people are saying essentially is only causing more symptoms to arise and more problems in the physical body. And this may be intentional because you want to be able to gauge it, but some of your practitioners aren't even trying to gauge it, like the PA that I saw the other day that rushed me out of the office. And essentially during my appointments, I'm always being rushed. So until you offer advocates that can go with us in person, for those of us that do not have family members to go with us, you are putting us at risk. You are putting us at risk. And it's a whole load of crock that you guys actually want to help. You want to harm, and it's harmful because if you don't know what you're doing, admit that you don't know what you're fucking doing and let somebody else take over, because otherwise you are causing harm. Fight for universal health care or be fucked by the system when you need it, because essentially that is what's happening to millions of Americans today. And that is what will happen to you the day you have something, a chronic illness or a terminal illness or an acute illness that needs medical care. Because essentially all of the holistic practices and medical care could be working together for true wellness through a universal healthcare system. They are choosing not to. It is a choice to be working in the way that they are working. So keep it up, guys. You're doing a great job. I love you and have a beautiful day.